Welcome to another video of Food Nourish Deep Dives. This is the videocast from foodnourish.net, where we love to explore all things health, food, supplements, and, those alternative approaches to wellness. Today, we're doing a complete guide on the side effects of hyperbaric oxygen therapy. So let's just assume you're here because you're thinking about hyperbaric oxygen therapy, or HBOT. You've probably heard some amazing things about it and you're curious. You want to know if it's right for you. And it's totally normal to also be wondering, okay, but what are the risks? You want to know about safety. You want to know about the potential side effects. And that's exactly why we're here today, to give you the complete, honest picture. Okay, so let's quickly get on the same page. What is HBOT? Well, at its heart, it's really simple. You relax in a special chamber, and you breathe in pure oxygen at a pressure that's about 2 to 3 times higher than normal. This process just floods your body with oxygen, which can seriously ramp up healing.
But before we dive into any of the side effects, I want to get one thing straight. This isn't some fringe treatment. Medical experts consider HBOT to be incredibly safe. When it's done by trained professionals, it has an absolutely stellar safety record.
And this number, it really drives that point home. According to the Undersea and Hyperbaric Medical Society, serious complications happen in less than 1 in 10,000 treatments. I mean, that is a fantastic safety profile by any measure. Okay, so with that safety net in mind, let's get into what you might actually experience. We're going to start with the common stuff. And the key thing to remember here is that these are almost always mild, they're temporary, and they're super manageable. The number one most frequent side effect, and it only affects about 2% of patients, is a feeling of pressure in your ears. Honestly, if you've ever been on an airplane when it's taking off or landing, you know exactly what this feels like. It's called barotrauma. So you might feel some of these things, a little ear pain, that feeling of fullness, maybe your hearing gets a bit muffled. This is all just happening because the pressure in the chamber is changing, and your body, specifically your eustachian tubes, just needs a second to catch up. And the good news is, it's so easy to fix. All you gotta do is simple stuff like swallowing, yawning, or doing what's called the Valsalva maneuver. That's just pinching your nose and gently blowing. Your technician will walk you through all of this, don't worry.
Now, this next one is really interesting. After a bunch of sessions, some people actually notice a temporary little shift in their vision.
What's happening is that all that extra oxygen can temporarily change the shape of the lens in your eye, making you a little more nearsighted. Things far away might seem a bit fuzzy. But, and this is the most important part, it almost always goes right back to normal a couple of months after you finish your therapy.
And finally, in the common and mild category, it's not unusual to feel a little tired or maybe a bit lightheaded right after a session. It's just your body readjusting from that oxygen-rich environment back to normal air. It passes really quickly. We're about halfway through, and all this talk about health is a perfect time to mention something that might help you on your journey. If you're ever looking for deals on wellness products and supplements, you should definitely check out our page at foodnourish.net/deals. We've got discounts from amazing brands like Perpetual Life, iHerb, Source Naturals, Nootropics Depot, and Biooptimizers. The link for that is in the description below.
All right, now that we've covered the common stuff, let's talk about the risks that are much less common, but are definitely important to be aware of, even though they are super unlikely to happen. This chart really puts things in perspective. You see, something like claustrophobia might affect about 15% of people to some degree. But then you look at a more serious risk like oxygen toxicity, and wow, it only happens in about 1 to 3 out of every 10,000 treatments. That is incredibly rare. Even though it's super rare, you should know the signs, like muscle twitching or sudden dizziness. But here's the thing. Medical teams are highly trained to prevent this. They use very specific protocols, with session limits and even air breaks, where you'll just breathe normal air for a few minutes to keep everything safe.
Now, to prevent another extremely rare issue, a lung injury, the rule is so simple. Just keep breathing normally. Never, ever hold your breath, especially when the chamber is decompressing. That's all you have to do to let the pressure equalize safely. Easy enough, right?
A few other little curveballs exist. For people with diabetes, HBOT can sometimes lower blood sugar, so you'll just need to monitor it. And once in a while, air can get trapped under a dental filling and cause some pain. This is exactly why it's so important to share your entire medical history with your doctor. Okay, so we've got all this great information. Let's turn it into action. Think of this as your personal safety playbook for getting ready for treatment. So, there are some pre-existing conditions that can raise the risk of side effects. For instance, if you've had ear surgery, have certain lung diseases, or, and this is a big one, an untreated collapsed lung, it's absolutely critical that your medical team knows about it beforehand. Honestly, being a total open book is your best safety tool. Tell your doctor everything. Every medication, every supplement, if you have a little cold, any recent surgeries, a history of anxiety, the more they know, the safer you'll be. And that rule applies once you're actually in the chamber, too. Communication is everything. If you feel any discomfort, any pain at all, you tell your technician right away. They're not expecting you to tough it out. They're there to help you. So let's sum it all up. What's the bottom line? HBOT is a very safe procedure. The vast majority of side effects are minor and go away quickly. And the single best thing you can do to have a great experience is to be an informed patient who communicates openly. We really hope this explainer has given you the confidence and the facts you need to go have a really productive talk with your doctor and figure out if HBOT is the right path for you. By the way, you can find a link to the full resource article for this in the description. If you found this deep dive helpful, please do us a favor and hit that like button. It really helps us grow our channel. And of course, subscribe so you never miss another explainer on important health topics. Thanks for watching.